So my name is Margaret Montgomery. I'm a technical officer with the Water, Sanitation, Hygiene and Health Unit in WHO in Geneva at the headquarters. Water sanitation and hygiene and waste disposal is obviously really essential to preventing infections. For example, you can't clean your hands, you can't properly clean surfaces and other materials if you don't have those services. But it's also really fundamental for quality of care. So dignity, for equity, patients need to have access to toilets, to showers, and in particular women and children. Often these facilities aren't accessible to them, or they don't provide the privacy or the types of services they need. So we know globally 8 million people die every year from poor quality care, and that includes people who can't access care, but also people that are accessing care, but it doesn't meet the minimum standards. And obviously water sanitation is critical to that. At the same time, we know that, for example, half of healthcare facilities in the world don't have hand hygiene at all points of care and at toilets. So some of these very basic fundamentals, even after COVID-19, are still missing. And that's really vital, obviously, to make sure we provide better quality care. In Ukraine, we know that around 31,000 people die of antimicrobial resistant infections every year. And again, that water sanitation is a fundamental element of the infection prevention control practices that are needed to prevent AMR. Here in Ukraine, WHO has been working on this issue of water sanitation hygiene for the past year and a half, and it's twofold. One, it's working with facilities like here at this training, using a WHO UNICEF incremental improvement tool to help them identify the risk, develop improvement plans, and then actually implement interventions, implement new management techniques to improve their water sanitation services. But there's also a really important national element around strengthening the standards. It's great, for example, Ukraine has new healthcare waste standards that very much align with EU and global standards. But there's other gaps that still need to be addressed, including in the legislation. So another thing we're working on is to make sure that these water sanitation hygiene elements and components are more fully integrated into the existing national platforms and standards, including through infection prevention control. So, and the last bit is around regulation and monitoring, and really seeing how within the health systems we can better strengthen the monitoring and the regulation to hold facilities and the officials to account for the services. Well, Wash Fit, I mean, this is our second training. We did a training about a year ago in Ternopil, and every facility improved their wash services. And part of it is identifies underlying factors that facilities may not be aware of. For example, not all facilities had safe drinking water for all their patients. So they requested to regional CDCs to provide the quality data. If quality wasn't met, they put in water filters or other types of treatment. So it's a really kind of practical, simple tool that facilities can use to identify actions, but also it gives scores, right? And so those scores can be presented to other authorities, in particular at the municipal level, to advocate for more investments in these services, which we also saw from the 3 oblasts that introduced the tool last year. At this training this week, we have 6 oblasts, and those oblasts are all from the east and the south. So it's a very different group of oblasts from previously we were working in central Ukraine. So these facilities have more acute problems. And the group I was working with today talked about the Kharkova Dam. When that was destroyed, they had a lot of issues with water. So their water supply was completely cut out, but they managed to put in 2 new boreholes. They also implemented water storage, and now they're able to not only provide water for their facility and the patients and the staff, but even for the community, which still is lacking safe drinking water. So for me, working with this group, it was really interesting to kind of hear about some of the initiatives they've taken on water quality, on water supply, but also on bigger issues around having this culture of safety and quality and regular communication about WASH and IPC with other facility staff and facility management. The first is just to raise awareness, right? I think before we started this work, it was kind of assumed that the water sanitation hygiene system was fine. But we've noticed, like through these efforts, that there are still gaps, especially around quality, especially around potential risks within the water supply, as well as the sanitation system. So one is to increase awareness. 2 is to really capacitate not just the healthcare facilities, but all the partners that are supporting them, like the regional CDC, the ministries of health, and obviously the other external partners that are here to understand the issues and to support them with investments, with technical advice. And I think the third kind of expectation, thinking longer term, after the war ends, to really see how we can use water sanitation as a way to strengthen the overall primary healthcare approach and quality care in Ukraine to meet standards within the European region. I've been really impressed about the training is how engaged the participants are. This group, they stayed up till midnight last night. They were already filling out part of the survey, so they came today ready to discuss the questions they had. And to me, it's really encouraging because it's not just about knowing the information, but it's about having the energy, the commitment, and that drive to really make change. So I'm hopeful that the personalities that we have here and all the facilities that are here were selected from a much bigger list. So they had to show their motivation and why they wanted to participate. And I think that really comes through here today. So.